BingX, a trusted global crypto exchange. Trade spot, futures, or copy top traders easily. Sign up via the link or referral code to get 30 USDT instantly, plus up to 1,500 USDT in bonuses for verification, deposit, and trading.
Australia stands at a critical juncture, poised to seize a unique opportunity to accelerate groundbreaking medical innovation. Independent MP Monique Ryan is spearheading a powerful call for the Albanese government to expedite funding from the nation's substantial medical research future fund, a strategic move designed to capitalize on a growing void in global research ignited by the Trump administration's drastic cuts to vital U.S. government-funded initiatives, as the United States government under Donald Trump aggressively curtails investment in scientific exploration and reshapes its public health agencies, sidelining experienced professionals and replacing them with political appointees. Australia has a chance to step into the breach and secure its place at the forefront of medical advancement. Monique Ryan, a respected pediatric neurologist and the member for Kooyong, is making a compelling case for the government to unlock a greater portion of the earnings generated by the $20 billion Medical Research Future Fund, exceeding the current annual disbursement of $650 million. This isn't a hypothetical scenario. Parliamentary Budget Office research indicates that even with an annual release of $1 billion for research, the total value of the MRFF is projected to climb to at least $30.1 billion within the next decade. The fund's performance since its inception under the Turnbull government in 2015 has been remarkably strong, consistently outperforming its benchmark with impressive annual rates of return. Ryan's persuasive argument highlights that a more substantial annual release from these burgeoning earnings can significantly propel life-saving medical breakthroughs. Current Treasury figures place the MRFF's present valuation at a robust $24.1 billion, underscoring the vast potential waiting to be tapped. This urgent plea for increased funding is not an isolated voice. It resonates powerfully with a formidable coalition of Australia's leading research and academic institutions. The esteemed group of 8 universities, the Association of Australian Medical Research Institutes, the Australian Academy of Health and Medical Sciences, and the Australian Academy of Science have all thrown their weight behind Ryan's initiative, recognizing the profound implications of inaction. Further bolstering this united front, a delegation representing prominent research organizations, including the Peter MacCallum Cancer Centre, the Burnet Institute, Research Australia, and the George Institute, will be making their voices heard directly in Parliament House. The urgency behind these calls is palpable. Ryan articulates a stark warning. Locking away this critical funding threatens the future of life-saving innovation. She paints a sobering picture of lost opportunities, revealing that hundreds of high-quality research proposals have gone unfunded in recent years. The message is clear. Releasing MRFF funds is not merely about safeguarding Australia's research sector. It is a direct investment in delivering tangible improvements to the health and well-being of all Australians. The strategic alignment of this push with the actions of the Trump administration is undeniable. Ryan directly links the need for increased Australian investment to the controversial decisions made in the U.S., citing significant funding reductions and staffing purges at agencies like the Centers for Disease Control and Prevention, CDC, alongside a deeply polarizing Health and Human Services Secretary. Experienced scientists have been displaced, replaced by individuals perceived as loyalists or lacking the necessary scientific and medical expertise. This dismantling of established scientific leadership in the U.S. creates a ripple effect, impacting long-standing and crucial collaborations between Australian researchers and trusted American health institutions such as the CDC, the Food and Drug Administration, FDA, and the National Institutes of Health. These U.S. agencies play a pivotal role in the global regulatory landscape, with FDA approvals for new drugs often serving as a critical benchmark for Australian regulatory bodies. Ryan's stark assessment of the situation in the United States is blunt. Trump has not only slashed medical research funding but has, in her words, eviscerated the U.S. CDC. This erosion of scientific infrastructure abroad raises serious concerns about the future of global health security and the very survival of world-class research institutes in Australia. Evidence from the Australian Association of Medical Research Institutes paints a grim picture, reporting earlier this year that without enhanced support, Many of its member organizations face the grim prospect of financial non-viability within the next 5 years. The severity of the proposed cuts in the U.S. is staggering. Trump's budget proposal, as revealed in September research, advocated for a 53% reduction in funding for the U.S. CDC, the elimination of over 60 programs, and the dismissal of an additional 16% of its staff. In a poignant demonstration of the tangible impact of this funding shortfall, Monique Ryan is scheduled to present specific research proposals that have been tragically overlooked due to a lack of MRFF funding. Among these is a vital clinical trial focused on pregnancy complications related to sleep apnea, championed by Amanda Popashekny, a specialist at Adelaide's Women's and Children's Hospital. Another critical area of unmet need is highlighted by Associate Professor Adam McKay from Monash University's Epworth Rehabilitation Research Center, whose innovative research aimed at improving the recovery of patients with traumatic brain injuries also missed out on MRFF support. This groundbreaking proposal sought to implement and rigorously evaluate best practice management strategies for post-traumatic amnesia, a debilitating condition following brain injury. Professor McKay poignantly states, "This research would have helped people with traumatic brain injury get the best possible care at a critical time in their recovery. Instead, we watched opportunities slip away." As Australia moves forward with legislation to establish a new Australian Centre for Disease Control nearing parliamentary passage, the timing for decisive action on medical research funding